Severe non-communicable diseases including type 1 diabetes, sickle cell disease, rheumatic heart disease, congenital heart diseases, chronic respiratory diseases are silently claiming lives across Kenya. In counties like Vihiga and throughout most regions in Kenya, the burden is growing steadily, often unnoticed. It is estimated that a significant number of children and young adults are living with these life-threatening conditions without knowing it. Many more face daily struggles to manage their illnesses due to poverty, delayed diagnosis, inadequate health infrastructure, and limited access to specialized care. But amidst the growing numbers, a glimmer of hope emerged. In December 2022, the groundbreaking of the Pen Plus NCD clinic at Amisi, Vihiga County marked a new chapter for severe non-communicable diseases management in the country.
Ni siku ya muhimu kwa vile ni siku ambao tumezindua kirasmi zahanati ya kipekee kwa hii nchi ambayo inahusika na yale magonjwa ambayo hayaambukizani, na ni zahanati ya muhimu sana kwa Kenya mzima. Tuko na mbili peke yake. Moja itazinduliwa huko Isiolo na hii ambayo tumezindua hapa.
Na iko na vifaa za kutosha, iko na madaktari wa kutosha, tuko na wauguzi wa kutosha, na kuna pia maabara hapa mzuri, na iko na equipment kamili. Kwa hivyo watu wajitokeze, wakuje, wapimwe, ijulikane kama uko na ugonjwa wa NCD.
Services will be more accessible to the community. People will be diagnosed earlier, and therefore they'll be able to manage this. And also another key component of this project is education on self-management. Non-communicable diseases tend to be lifelong conditions, and even though you're put on medication, you should be educated how to self-manage the condition. If you're living with diabetes, how do you manage your sugar? If you're with sickle cell, what do you need to do in order to try and prevent sickle cell crisis? So that is a key component of the project, and that is a key component of one of the things that these two Pen Plus clinics will be doing. By
June 2023, during the World Sickle Cell Day commemoration, the clinic was officially launched. A lifeline for NCD warriors, not just in Vihiga, but across neighboring counties.
Other counties will be able to use this platform as a site for learning lessons, critical lessons, that then can be able to assist them to be able to implement this decentralization of NCD services, bringing services closer to the primary healthcare level so that we can be able to entrench public health prevention and health promotion at the community level.
Just to also mention that the Pen Plus strategy has been adopted by the African Ministers of Health as a strategy to address non-communicable diseases in Africa. So essentially, these are two just the initial implementation projects in Kenya, here in Vihiga and also in Isiolo, but we're looking at developing a national-wide rollout program for these facilities to be rolled out to the other counties in Kenya.
Since its opening, the Pen Plus clinic has transformed lives. Over 200 patients with sickle cell disease now benefit from regular screening, diagnosis, and essential medication. More than 300 individuals battling hypertension are under active care. At least 74 patients with diabetes receive ongoing medical management.
They have been incorporated as warriors, and they have built us a clinic, Pen Plus, at Hamisi here, Sub-County Hospital. And all the services are free, including drugs and tests. So we are here today to give support to them and thanking them for bringing us these services home.
On a typical day, more than 30 patients with NCD-related conditions walk through the clinic's doors, receiving care that will otherwise be inaccessible.
And in the past, children living with type 1 diabetes or living with sickle cell disease or rheumatic heart disease did not live to the age of 5. Many of them were not able to get treatment and care, or were not even diagnosed, and so they died prematurely. So Pen Plus project is looking at how can we support families and children living with these conditions for them to get firstly the diagnosis, the treatment and the care that they need at a facility which is closer to them, and this will obviously reduce the cost in terms of transportation and access, and also for them to get the treatment, the education that the family needs to be able to manage these conditions, so that these children can actually live out their life to their full potential without severe complications.
Beyond the facility, outreach programs continue to raise awareness on NCD prevention and management. Community health promoters, caregivers, and warriors themselves are leading efforts in advocacy, screening, and early detection.
So we want them to live a life like any other person.
A powerful community-led movement. Recently, the clinic hosted a major medical camp offering free screening, medication, and education to over 250 sickle cell warriors and their caregivers.
Tuko na vifaa vya kupima, ile inaitwa scanning, sickle cell scan, ambapo wachumba wapenzi wakipatana, msichana na mvulana, tunafanya screening waweze kujua hali yao ya selemundu.
Sasa leo tuko hapa kuelimisha watu ama kuelimishwa pia, kwa sababu masomo haifiki. Sasa mimi nikiwa hapa ni warrior niko na umri wa miaka 40 and I'm also a mother. I'm a warrior, I'm a mother. It means mimi caregiver pia. Na sio mwisho wa maisha ukiwa na sickle cell, maisha bado inaendelea. Ni wewe vile unajiweka, ni Mungu ndiye ako na tarehe yetu ya mwisho.
Watu wale wameitwa wametoka sehemu mbalimbali, kutoka hapa Vihiga kwanza na hizo majirani zake. Kuna watu kutoka Siaya, Kisumu na Bungoma na pali nyingi, ili waweze kuja pia wajuane.
The Pen Plus Clinic in Amisi, Vihiga County is a shining example of devolved healthcare in action, bringing services closer to those who need them most.
And I think if we return here tomorrow, we would see the clinic not full of visitors, but we would see the clinic full of patients.
As we look forward to the future, sustaining and scaling such initiatives is not just necessary, it is urgent.